Hello there, this is Dr. Kent Laughley from drlaughley.com. I've been seeing a lot of patients recently that have plantar fasciitis, so I wanted to take a minute to reach out to you to talk to you about how to get rid of plantar fasciitis heel pain fast without the painful injections or expensive orthotics. So, quickly, I want to review with you what this presentation is going to have. I know that there are a lot of you out there that have heel pain right now, so I'm going to start off by showing you a 90-second stretch that you can do to relieve your heel pain. Then I want to review the background of plantar fasciitis, talk about how we get the diagnosis of plantar fasciitis, and the treatments that you can do. And then in summary, I want to go through my heel pain relief protocol that puts all the pieces together so you know what to do on a day-to-day basis to help treat your plantar fasciitis. So, as promised, the first thing that you can do right now and follow along with me is a 90-second heel pain relief stretch, okay? To do this, you take the foot that's been bothering you and you cross it over on your opposite leg. And then you'll take your hand and a finger, and near your heel, you're going to push along until you find the most tender location on that spot. Once you find the most tender location on the bottom of your foot, we're going to give that a pain number, and that number is going to be 10. Next, you're going to take your hand and secure your toes on your affected foot, and you're going to pull your toes back towards the sole of the foot and that heel. And you can see the red arrow in the picture outlining that. As you're pulling back like that, your pain should begin to decrease. Next, while maintaining that downward stretch, you can gently rotate your toes either clockwise or counterclockwise until you feel that that pain that we determined was a 10 is now a 3 or less on that scale. Once you find that position, I want you to hold your foot in that position for 90 seconds. At the end of the 90 seconds, you can relax your foot, and then you can touch that tender spot again and reevaluate your pain level. Your pain should be 3 or less, and or in some cases, your pain should be completely gone. So go ahead, take a second, pause the video, and try this right now to help with your heel pain, and then leave a comment below about how this worked for you. So, a little bit about plantar fasciitis in general. Plantar fasciitis is a very common form of heel pain. About 1 million people in the U.S. go to a medical provider every year to get treatment for their plantar fasciitis, and about 10% of the U.S. population will have plantar fasciitis at some time in their life. The most common age is to get this between 45 and 64 years of age, and then a younger age group and those who are long-distance runners typically are affected before that age. This is more common in women than men, and up to 1/3 of the cases happen in both feet. So how do you know if you have plantar fasciitis? Well, the first steps in the morning are typically very painful. It feels like there's a stabbing sensation, a sharp sensation. And if you reach onto the bottom of your foot, you'll notice in the picture that red X, that's the most common place to have that pain. And so if you push there, that should reproduce a sharp, stabbing pain. The pain could improve after you're up for a little bit in the morning and moving around, but typically will worsen again after you walk for a long period of time or you stand for a long period of time. So there are several things that can put you at higher risk of having plantar fasciitis. That could be having too flat of feet or too high of arches. Also, if you're a long-distance runner, that puts you at higher risk of having plantar fasciitis. If you don't move around very much or exercise at all, that puts you at a higher risk. If your legs aren't the same length, that could put you at a higher risk. If you're overweight, or if you're in an occupation where you have prolonged standing or walking, that can put you at a higher risk of plantar fasciitis. And then if you have accompanying tightness in the Achilles tendon or the foot muscles. So if you were to go to a doctor and they were going to do an evaluation for your plantar fasciitis, doing blood tests of any sort is not helpful. And you really don't need any testing at all for a diagnosis. It's really made off of what you tell the doctor and what they see when they do an exam. X-ray may be one of the most common tests ordered if there is a test ordered. It's usually to rule out other conditions more than tell you that you have plantar fasciitis. And sometimes when you get an X-ray of your heel, there will be a heel spur there, but the heel spur is not the cause of the plantar fasciitis, and it's really unrelated except for plantar fasciitis may cause some extra strain and inflammation in that part of the heel to cause the heel spur, but it's not what's actually causing the pain of the plantar fasciitis. So, what is the plantar fascia of the foot? Well, on the bottom of our foot, to help support the arch, we have a band of tissue. That's kind of a ropey fibrous material, and it extends from the heel of the foot up to the ball of the foot, connecting to each of the bones that make up the ball of the foot. I like to compare it to a rubber band between the heel and the ball of the foot. If that rubber band is pulled tighter, okay, or if the plantar fascia is tighter, then that band is short and the arch is high. If that band is a little bit looser, then that band is long and the arch of the foot is low. So what happens to the plantar fascia to actually turn into plantar fasciitis? Well, if we go back to the root of the meaning of the word, fasciitis, itis means inflammation, so fasciitis would mean inflammation in the heel. Well, it turns out as they've done more research on plantar fasciitis, that's a misnomer. That's not an appropriate term for this condition because it's not caused by inflammation. It's caused by overuse from constant running, standing, causing little micro tears in that fascia and pain. So maybe a more appropriate name for plantar fasciitis would be plantar fasciosis or plantar fasciopathy or just plain plantar heel pain. So, if you think you have plantar fasciitis from what I've described, what can you do to help with the pain? Well, the good news is there's a lot of non-invasive treatments that can be done, and 90% of cases will get better without having to have any expensive orthotics, injections, surgeries, or other more invasive procedures. So the number one rule that I tell everyone right off, once you've decided you have plantar fasciitis, is to never walk barefoot. Okay? Your plantar fascia is in a state of stress. It is tender, it is injured, and so it needs that support from wearing a supportive sandal, a supportive shoe with a good arch to help maintain its form and to relieve its stress so that it can heal. So you're never supposed to walk barefoot. That means even if you get up in the middle of the night to go to the bathroom, you need to slip on some supportive shoe wear. First thing in the morning, you need to put on some shoes. Next, besides never going barefoot, you need to rest the foot. So if you're a long distance runner, I suggest you decrease your running by at least 50% and take time to elevate your legs and just not stand as often on your feet to help reduce some of that pain and that repetitive injury. Next, if you're really uncomfortable, you can take pain medications. And if you don't have any medical conditions that your doctor said that you cannot take over-the-counter meds such as ibuprofen, Aleve, then you can take that type of medication to help with the pain. And I don't recommend doing that for a long period of time, but it would be okay to do that for about 2 weeks. And if you are going to take an ibuprofen or Aleve type of medication, I recommend that you would take it with food. And then another thing you can do is ice the bottom of your foot. And the easiest way that I found for people to do that is take a regular water bottle as pictured here, go ahead and freeze that, and then when it's time to ice your foot, you can take that water bottle out, lay it down on the floor so it can roll, and then you can gently roll your foot out on top of this iced water bottle, and that can be very relieving at the end of the day to help with the pain and swelling that can develop with plantar fasciitis. Next, you can do stretches. And here's an example of a plantar fascia stretch. And this is very similar to the 90-second stretch that I was talking about, but we're actually going to stretch the foot in the opposite direction. So if you were to perform the plantar fascia stretch, you would cross your affected leg on your opposite leg, like shown in the picture, and then you're going to secure the toes of your affected foot and pull them backwards towards your shin until you feel a stretch in the plantar fascia. And you can confirm that you have a good stretch by placing your finger on that plantar fascia and feeling how tight it gets when you do this stretch. This stretch can be performed every day before you get out of bed, before you even take that first step, and that can help relieve a lot of the discomfort that you may have first thing in the morning. Another stretch slash strengthening exercise are heel raises. And heel raises can make a big difference in long-term control of plantar fasciitis because now you're going to actually strengthen the intrinsic muscles of the foot as well as the calves to be able to provide more support to that arch and limit the pain of plantar fasciitis. So to do this stretch, you need to find a step. It can be a set of stairs in the house, it can be a block, it can be a different type of step, but you need to have a step, and then you're going to take a towel and you're going to partially roll that towel up and set it on the step. The idea behind the towel is to, when you put your ball of your foot on the step, is that the rolled up portion sits underneath the toes to pull them back up towards your shin. Okay? So as pictured here in the first picture, you put that towel across your step, place the ball of your foot on the step with the toes over the towel, and then you're going to perform a heel raise by slowly raising your heel up over 3 seconds. When you reach the top of that stretch, you're going to hold it there without moving for 2 seconds, and then slowly lower down over 3 seconds, as shown in the second picture, until your heel is dropping below the level of the step. And then you can repeat this 12 times in a row. You need to do the heel raises every other day to allow your body to have a time to rest and recover between this strengthening exercise. Foot orthotics are another good option to help with heel pain, and these work better when you use them with a stretching routine that we've already talked about. And you would think, well, maybe I need to go out and get really expensive $300, $500 custom orthotics that are made to fit my foot. Well, the research shows that for people who are just starting out treating their heel pain, the custom orthotics are not any better than the ones you can just buy that are already made off the shelf. And silicone inserts with stretching from these studies have shown the best outcomes. So you may want to consider a silicone heel insert like shown here in the picture and do that with the stretching routine that we talked about. Now, if we put all these pieces together into a daily routine, this is what it would look like, okay? So, on even days, you would get up first thing in the morning, and before you even get out of the bed, you would perform the plantar fascia stretch that I showed you earlier. You would do that stretch 10 times and holding it for 10 seconds each time before you even get out of bed. When you get out of bed, you need to put on your shoes or your supportive sandals before you take that first step of the day. And again, the most useful type of orthotic, if you're going to use one, are the silicone gel heel pads. And then, if you would like to, you can add in a non-steroidal anti-inflammatory drug such as ibuprofen or Aleve in the morning to help with the pain and discomfort with food. At the middle part of the day, you need to repeat the plantar fascia stretches again, 10 times for 10 seconds each, and then at night, I recommend that you go ahead and do the ice massage that we had talked about, where you take that frozen water bottle, put it under your foot, and roll it out. And then you can do your plantar fascia stretches after that, and then another dose of anti-inflammatory pain meds if you feel like you need it. If your pain is severe during the day, you can go back to that first 90-second heel pain relief stretch that I showed you, and you can use that as needed to help knock down your pain immediately. On odd days of the week, you're going to do the exact same schedule as the even days, but you're going to add in the heel raising exercise that I showed you earlier. And you're going to do 12 repetitions of that sometime during the day, every other day, to build up your strength and continue to stretch out all the muscles related to your heel pain. So what if all of this doesn't work? What if you need more help? Well, I would recommend giving this heel pain relief protocol a trial for at least 2 weeks, and then if you don't notice any improvement, you should follow up with your doctor. I personally recommend seeing an osteopathic physician because there are other treatments similar to the 90-second heel pain relief stretch that we can do in the office to help with the muscle tightness, the plantar fascia, and really get that released and take care of your pain right away. So one place you can go to look for a DO that's near you that performs OMT is going to doctorsthatdo.org. And in addition, there may be another type of heel pain problem that you are experiencing. Even though plantar fasciitis is one of the more common causes of heel pain, you may need some further testing to rule out other things that could be a problem. So if you do this for 2 weeks and are still having problems, I recommend you get in to see your doctor. Hey, thanks a lot for taking time to listen to my presentation today. It's a pleasure to be able to talk to you about plantar fasciitis, and hopefully you were able to get some immediate relief from the suggestions that I shared today. If you had success with this, please share it with someone else or leave a comment below saying how the 90-second stretch helped relieve your pain or how the other stretches are working for you. Thanks a lot and have a great day.